going to show you how to prime an IV for a continuous IV solution. We're going to start by finding the appropriate IV solution based on our physician's order. We're going to do all of our checks, our 3 checks on our medication. We're going to also verify our patient. We're going to do our hand hygiene, and we're going to prepare our solution. So the first thing is when you get your IV solution after you've done all of your checks, you want to open up your bag. Sorry, this is going to be loud. When I open up my bag, I'm looking at my solution for its clarity, making sure that the expiration date is not expired, and I'm looking for any cloudiness. I'm looking for the intactness of the bag. Okay, so I'm going to hang that up on my pump. And I'm going to pull this valve right here because I want to open up the IV solution and get it ready to be primed with my tubing. Okay. There is a valve inside of here, so once I open this up, nothing has been broken. The seal has not been broken yet, so I'm not going to be splattered with IV fluids. So if I'm doing a primary continuous infusion, I want to have primary IV tubing. This one is a 15 drop per milliliter tubing. So I'm going to open up my tubing here. When I open up my tubing, the very first thing that you need to make sure you do, you can see it's a long tubing, it's going to be coiled in your hand. The very first thing you want to do is find this roller clamp, and I want you to roller clamp it down. This is going to protect your tubing so that when we spike our bag, we're not going to get filled with a bunch of air bubbles into our tubing. So we're roller clamped down. The next thing I'm going to do is I'm going to get my spike prepared. I'm going to open it up, keeping that sterile. I do not want to touch and contaminate that. And now I'm going to come over to my bag, and I want to get my spike into the bag. And so I'm going to twist until I get that into the bag. Now I want to fill my chamber, so I'm going to squeeze it until it's about halfway to 3/4 full. And then I need to get the rest of my tubing set up in my hand. This particular tubing, the manufacturer wants this blue tab to be up so that this portion of the chamber gets filled properly. So we're going to start with having that blue up. And then each of these infusion ports need to be upside down. So I'm going to put this in my hand, and then I'm going to start to ravel everything else in so that all of my injection ports are upside down. Here's another injection port. It's going to go upside down. And then I have one last injection port, and again I want that to be upside down. So you can see they're just kind of raveled in my hand, all upside down. Again, with this in this direction with the blue clamp up. The next thing I'm going to do is I'm going to open up my roller clamp, and I'm going to slowly fill my tubing with saline. And you will start to see, I don't know if you'll be able to see it in the video, but you will start to see it filling up. It's kind of starting to come down here, and here it is at this point, filling up this chamber. The purpose of putting these injection ports upside down is it fills the injection ports so that there is no air left inside those ports. And at this point I'm watching until I can get it down to my end. Okay, and it has come out at my tip. Okay. The next thing I'm going to do is I'm going to put the tubing into my pump. For this, there's a little magnet on there, and that's going to set right here onto this magnet. And there's also little holes that are going to set the tubing in here. And then the blue clamp is going to set inside of here. You can hear that it clicked. And I'm going to close my pump. Okay, at this point I want to do new patients. I've already turned my pump on. It goes through a beeping stage and like a self-check stage. So once it goes through that self-check, this is the screen that you're going to come upon. So you're going to see new patient. I'll press enter. And I'm going to come down to basic infusion. So I'm going to down arrow to basic infusion and enter. And at this point it has pulled up my primary, where I can plug in my rate, which is my milliliters per hour, as well as my volume to be delivered. So here's where I need to know what my physician's order is. So perhaps the order is for 50 milliliters per hour. My volume to be delivered is the volume that's in my bag, which is 1,000 milliliters. And so now I need to connect it to my patient so that it is ready to infuse. Prior to connecting a primary tubing to your patient, you will want to make sure that you have a secure IV site. You also want to make sure that you have flushed that IV site in preparation. Again, the saline is a medication, so we've done all of our checks on our normal saline. Please refer to the previous slide about saline flushes. At this point, I'm just going to demonstrate so you have the understanding of all the steps involved. So again, we're going to have done all of our checks on the saline. I'm going to scrub my hub for 15 seconds. I'm going to break my seal on my saline, remove the air. Unclamp my J-loop. And now I'm going to flush it for 3 milliliters. Grab another alcohol swab. Scrub my hub for 15 seconds. And now I want to connect my primary IV tubing. So I'm going to take my cap off. Again, a needleless system. Push in and twist. So at this point, everything has been verified. Our patient has given us their name and date of birth. We verified their armband against their medication record. The medication we've verified. And now we're ready to start the pump. So I need to unroll, open up my roller clamp, and then come back to my pump. I want to be on primary. I've checked my order, 50 milliliters per hour, and I'm going to press primary run. And then you will see the pump is running. And you can also see here there's a green light that's showing that it's running. The last thing that we need to do is, well, second to last thing, is we need to label our tubing. Our tubing at this hospital, our policy is change it every 96 hours. So we will get a label that indicates a 96-hour change date and put that on the tubing there. And then we need to document it in our medication record. We also want to put a label, a sticker with the date, the time, and our initials that we hung the fluids, because these bags are good for 24 hours. So we would get a white label and tape it onto that bag so we know how long the solution has been up for. And that's how you do a primary IV.